Hi class, this is my maternal substance use disorder and suicide prevention evaluation plan. Alright, so this slide talks about knowing the facts of maternal substance use disorder and suicide prevention. So there has been a research gap that has been identified within this population. It shows that there is an increased need for social service providers to be able to provide effective postnatal care for postpartum mothers. So this shows that there can be an increase emphasis on increasing maternal mental well-being after giving birth to increase mothers' emotional well-being and help them provide better care for their children. So this shows that research needs perinatal interventions that target suicidal ideations within this population, and we have the goal to reduce them for women with both a diagnosis of substance use disorder and postpartum depression. This slide looks at the strongest evidence-based research out of the 3 articles that I looked into. The research methodology that I found was the most effective was by Tachibana et al. 2020. So I determined this by looking at the graph on the right side of the screen. The most effective and most likely to be implemented in practice were the meta-analysis and systematic reviews. Then going down, we have the randomized control settings, we have cohort studies, case control studies, then we have at the bottom case reports and animal and laboratory studies. So when looking at the sample size for this particular article, it was 464 women total, 230 women were in the control group, and 234 were in the intervention group. Some strengths of this study was it was cost effective. There was voluntary participation on behalf of the women who were engaged in this process. The ethical justifications that were a part of this study were seen as a strength because it prioritized safety, and if they needed treatment, they got treatment immediately for what they needed. This shows that there is real-world setting practices that can be implemented from this particular study, especially when they are in active crisis. They are going to be referred out and get the treatment that they needed. So when looking at the weaknesses of this study regarding internal validity, this had to do with selection bias because it was non-randomized. This showed that there was initial differences between these groups, which increased the amount of confounding variables that were going on. A lot of times we couldn't recognize if the treatment was the reason that they were having reduced suicidal ideations or if it was just because of other facts that were occurring, other history that had occurred. So this led to attrition within the study, which led to people dropping out, people not wanting to participate because of fear of being watched and observed. So this led to lack of external validity. So this shows that there was lower reliability for causality. They were not able to determine if the reason why they were showing improved mental well-being was because of the suicide prevention program or if it was just because of situational awareness that they were developing. So this definitely led to limited generalizability within the general population, and it showed that there was a risk for manipulation on behalf of the researchers. Alright, so this slide talks about social work practice applicability. So out of all 3 articles, the one that I found would be the most effective in actual social work practice is an article by Hesser et al. 2015. The intervention strategy that were used is case management, crisis intervention, and community-focused interventions. And I found that community-focused interventions are the most supportive when regarding their emotional well-being, increasing their social support that they have, emotional support that they have, and taking on community-focused intervention helps them feel more supported within the community, especially with getting access to resources that they need and any type of help that they may need within their own community. So potential clients that may benefit from this program is mothers with a diagnosis of substance use disorder and their children. This could be seen in different practice settings. A lot of times it will be criminal justice referrals, self-referrals, and community and other provider referrals towards social workers within the field. So when talking about the community and client context, a lot of times these women will be in treatment programs, 24 outpatient, non-methadone, 11 residential settings, 4 methadone maintenance rehabilitation settings, and 4 mixed modality programs, which has to do with a mix of outpatient and intensive inpatient. So when talking about accessibility, especially for social work, financial barriers were found. 58% of women within this population had to receive public assistance coverage to be able to get access to therapy, to be able to get any type of insurance that they may need. This was all funded through state insurance, so this shows that there is a lack of ability to actually have private insurance, especially because they don't have employment opportunities. So this leads to lack of transportation, which, they need help getting to therapy sessions, they need help getting to doctor's appointments, any type of, check-ins with how the baby's doing, especially for postpartum women. They need access to doctors who can help them make sure that their babies are doing good and, that their mental well-being is increasing, not decreasing. So regarding clients' needs, this varies depending on the severity of use, their social support, their emotional state. Families who need more support would probably be referred to inpatient treatment, which is more intensive and structured towards these needs. So family, group, and individual therapy would all be beneficial to the children and the mothers who need these direct services. So this is the evaluation plan that I would be doing. The evaluation design is going to be an experimental design with random assignment, so a randomized control setting. There is going to be a control group and an intervention group. So the focus is going to be needs assessments, assessing the needs of postpartum mothers who have a diagnosis of substance use disorder. So I'm going to evaluate this through an impact evaluation, measure the impact of the intervention program for suicide prevention, and also assess the needs of mothers postpartum and what they feel that is most likely to be a need of theirs to feel more supported. In order to do evaluation measures, it's going to be a mixed methods approach using qualitative and quantitative measures. There is going to be laboratory testing, such as urinalysis, and clinician-administered assessments. It's going to also include a structured interview to help with qualitative needs assessments, and also it's going to have self-report questionnaires. So the evaluation tools that will be used initially are the DAS-10, which is the drug abuse screen test, the ASI, which is the addiction severity index, and the CBCL, which is the child behavior checklist. So I wanted to clarify that the reason why I said initial for these is because these aren't going to be continuously tested. These are going to be tested initially when they have the first intake, and then afterwards the weekly assessments are going to be used with TEA, which is Treatment Effectiveness Assessment. So this is going to help give more information on the effectiveness of the intervention itself. These are going to be weekly, and it's going to help evaluate the effectiveness of the intervention. And this is going to show if there is reduced suicidality within this population. And the other weekly assessment is the TLFB, which stands for Timeline Followback. So this assesses drug use at any point in time. This is going to be the 2 weekly assessments that are going to be done. Regarding progress monitoring, there's going to be 2 random urinalysis weekly. This is a non-negotiable. So in order to effectively show if their substance use has reduced, there has to be urinalysis done weekly. So the self-report questionnaires that are going to be taking place are the TEA and the TLFB. This also shows that there is going to be monthly assessments of progress depending on the severity of the symptoms, and weekly assessments if increased severity occurs. All right, so this talks about progress monitoring. So in practice, this would be seen by evaluating the client's systems evaluation. So this is evaluating their progress towards relationship building and increasing their self-confidence and self-worth. So there is certain tools that can be used to assess this. A lot of times the most common ones are biopsychosocial assessments, psychosocial assessments, and ecomaps. Specifically, social workers focus on psychosocial assessments the best because they like to evaluate the impact of the social environments and the effect on the psychological impacts on the brain and the body. So a lot of times those two will be the most common. A lot of times therapists will use ecomaps, which is basically a mind map of how their relationships that they have or they want to build, how they are strained, if they're strong, who they think is the most impactful on their life, just looking at the different relationships that they have within their life and how it has shaped who they are today. So when looking at outcomes, the desired outcomes that we want to have for mothers within this population is reduced substance use, and we want to improve their overall mental well-being, such as decreasing their anxiety and depression symptoms, and increase their feelings of internal capabilities towards parenting. So this has to do with goal monitoring. The client and the therapist will monitor goal progress weekly and reassess each week if goals have not been reached and how they can make sure that these goals are actively being implemented within their life. So when looking at implementation in practice, this plan can be implemented in both outpatient services and inpatient services. And in order to effectively monitor how the progress is going, the social worker can use process evaluations, and they can also use outcome evaluations.